Hello and welcome to Rive Reflections in Veterinary Education. I don't know what episode we're on. I never say that, and maybe we should, but we're not going to because I don't know where we are. But we are having another interview episode, which I'll be honest are often my favorite. So super excited to welcome Jake Wolf, veterinarian criticalist, and our guest today. So Jake, welcome to the show.
Thank you very much for having me.
So I will just share with everyone the reason I reached out to Jake. So Jake is a fellow criticalist, but that's actually not really even how we know each other. Jake and I have never worked together as criticalists or clinically, but it's actually through like education things. Jake is at the University of Florida, which I did used to work at, but we did not overlap at all. But
I
we
think
ran
just
into,
as you were leaving
yeah,
with,
yeah.
yeah. Hmm.
We ships in the night kind of a thing, but we met at the Cornell Veterinary Educator Symposium. I don't remember the title of it. That was in Florida a few years ago, and that's really where I was like, "Oh, are you interested in education?" So that's kind of where we really first started chatting about things. And so, Jake is early career faculty, and but also like super energized and already really getting into education. And so I thought he would bring a cool, unique, fresh perspective on where the state of things are now, in veterinary education and like your perspectives on things versus how they were 10, 15 years ago. Because I think and I hope things have changed, but I'll be interested to see. Um, so any initial burning questions for Jake? Otherwise, we'll probably start with the usual.
Yeah, go ahead, Bobby.
All right, Jake. The usual is tell us a little bit about yourself because,
Yeah.
a lot of listeners probably don't know. And I think Catherine and Eric are both like, yeah, we don't know either. So share the cool parts about your history and like kind of what your background, how you got into, vet med and then particularly veterinary education.
Absolutely. So, before we started recording here, you guys were talking about the freezing cold temperatures, and that reminded me a lot of growing up because I'm from upstate New York, the Syracuse, New York area. Hence why I'm in Florida now. So from Syracuse, New York, I went to George Washington University in Washington, D.C. For undergrad, and majored in religion there for my Bachelor of Science.
Wow.
And I had initially planned to go to law school, and had like taken the LSAT, applied, got in and stuff. And then this was my third year. I was going to finish a year early. And then I said, this doesn't interest me at all, actually. And took my fourth year, added on a biology major or a biology minor, and decided to go to vet school instead. So I took a couple years in between to work in vet clinics to make sure that was what I wanted to do. And then went to Cornell for vet school. I finished there in 2017, and then did my rotating internship in my ECC residency at the University of Pennsylvania, finished in 2021. And so I've been at University of Florida for about 3 years now.
Love that.
Finally got tired of all that cold weather.
Exactly. Never moving south
Yeah.
is the goal. 4 years back up there was enough. But I think my it's I don't know, when I look back and reflect kind of on when I first started, I think the first identifying moment for me that was a real like aha moment was during my fourth year at Cornell. Each student has to do a senior seminar on like a case and then discuss a disease related to that case. And so and then you present to the entire hospital, and it's like a 15 or 20-minute presentation or something like that. So I did one for my oncology presentation on polycythemia vera, a dog that we treated that had that. And I had no knowledge that prior to that, I hadn't really done much formal teaching or lecturing or anything like that. And I loved it. Like I absolutely like, and that was a moment where it was early enough that I was like, I want to do an academic internship and residency after this. And then that was the first time that I'd ever considered staying in academia. And I think that was like the real burning moment that kind of stimulated my passion for education, and also kind of helped guide my approach of we need to give students opportunities to teach, and opportunities to lead, because that's how we create future educators.
I
Do
love
do you identify as an extrovert, Jake?
Yes. Yeah.
Okay.
Yeah.
I'm just thinking about my experience the first time getting in front of a group, and I cannot possibly translate anything close to that experience to wanting to do more of it.
Yeah.
Yeah, it was actually, that's interesting because I was going to ask you as a follow-up, and I don't know that I've asked either Bobby or Eric this either, is like, what was it about that moment that was like, oh man, this is for me? Because I talked to a lot of instructors and asked them, what it is they love about teaching. They're like, oh, I love it, that aha moment when you see the student learn and this and that. But as I'm hearing you talk, which is not necessarily the case for me, but when I hear you talk, I mean, I'm assuming that you didn't necessarily see the light bulbs come on because you were a fourth year student talking to your classmates. Maybe you did, but so I was just curious, like, what was it about that was like, wow, this is awesome?
I think it was getting to like having a narrow enough focus that you got to dive into doing research and learn a lot more about your topic. And then like when designing your presentation, got to I don't know, I'm someone who likes using a lot of like animation movement based things in mine. And so getting to like kind of work, and that was the first one that I did that on, I think. So it took me way longer than it does now, like trying to, get the Jack stat pathway to move along. But I think those portions, and then I like speaking, and like I did theater throughout vet school.
Okay.
I'm in choir, things like that. And so I think those portions, like getting to work on it, I really enjoyed. And then getting up there, I still get nervous for each presentation, I think. And I think probably most of us do, but then like getting into it and kind of getting to be formal, but also like move in kind of like your improv sort of jokes in the moment and stuff. I just found that exciting.
So I'm going to ask Eric that question because I think Eric and I are very much introverted and you and Bobby are very much extroverted. So I'm curious.
an ambivert. I'm not actually as extroverted as everyone thinks.
But do you identify more as an extrovert than an introvert, or are you more like an ambivert?
I'm an ambivert for sure.
Okay.
Yeah.
Okay. So I'm curious, Eric, about what it is about teaching that you love. Like, especially at the beginning.
Yeah, so my earliest teaching experience was as an assistant martial arts instructor. And so I just like it was a thing to do, and it was fun and satisfying. And I think we've talked about this before, that I conceptualize that there is an academia class in this country, and I very much was raised in that class. And so I'm like, what else would I do? Like, of course, I'm going to go get higher education and, probably be a professor. So I don't think, like, I can't really think about any kind of turning moment or at any time I made a conscious, clear decision. It was more like, yeah, of course I'm going to do this.
So one thing that struck me about when you were describing kind of really getting into, what was it about, Jake, was really figuring out how to teach is itself a kind of problem solving, right? Like, okay, I have just dug into all this, and like, we don't really learn about polycythemia vera much as students, right? Like, we're not spending days and days on this disease, right? Appropriately, right? Like it's rare. You probably shouldn't dedicate a lot of time, but you then had this case. So you had an opportunity to dig in, and you're like, okay, but now I have 15 minutes to explain this to people. And so like going through that problem solving, I think I agree that process is really fun. How do I take this, what could be maybe a really complex or complicated thing, and that's a challenge, right? To try to figure out how am I going to explain this in a way that will make sense, that's kind of interesting, because I want to engage people and I want them to pay attention, but I want them to learn something. And so like, that's a fun challenge. What I do think is fascinating though, is how your thing is like the public speaking part was what I really liked. I think that's what we were like, wait, what? That is
I mean, I
not a
think that's what
common
first stimulated it. Is that my
Yeah.
favorite part?
Cool.
No, but
I love it.
yeah.
I love it. And I think you're right. Because I didn't think about academia until after I was in my internship. And then I was debating about when I decided to do residency, it was like, if I'm going to do this, I'll probably go the academic route. But I had done a lot of things that were in the line of teaching. And, you know, I definitely with peers and things like that, I did always enjoy that process of like figuring how to restructure this in a way that might make more sense, both for me. And then if I figured out something and I could share it with others, be like, wait, I think about it this way. Is that people are like, oh, wow, yeah, that does make a lot more sense. That was really satisfying for me. So that problem solving piece of education, I found really, really exciting. And that's what I was hearing when you were talking about that. Like, how do I take all of this and, you know, change it in a way to make it accessible and interesting for others?
Bobby, did you have a tipping point that you can think of?
I think for me, I don't know if it was like a one period thing, but during my internship, we had as interns a lot of time, like without a lot of supervision. And so in ER in particular. And I liked ER, obviously, and I wasn't planning on specializing in it, but I would be running the ER with students. So like the people who are a full year behind me, like way behind me, right? And here I am being expected to kind of like teach them and train them. And like I would do rounds, you know, because I'd seen that from other people. So like, okay, let's do some rounds. And I also realized that talking about those things helped me. And so I did enjoy that part of the job, and I felt like it made me better as well. So when I made the decision to pursue residency and specialization, I was at that point, I was like, yeah, I want to stay and teach. I think that it also keeps the medicine fresh for me. You know, seeing my 600th blocked cat by myself doesn't sound nearly as fun as like seeing it and it's your first one and through your eye. Like that's way more exciting for me. So
it kind of makes that we've talked about this before. That I've heard people with children say that exact same thing.
Yeah.
And I think Bobby, you've said like, oh, this like these students aren't my children.
Yeah.
Catherine, did you have a tipping point?
So I'm thinking about this, and I would say maybe. I think when I never really thought I would be a teacher because both my parents were teachers, and A, I didn't want to do what my parents did, and B, I didn't want to be poor for my entire life. But I guess I got into teaching by accident. So I actually started a Doctor of Public Health degree a few years after I'd gotten out of vet school. And I discovered pretty quickly that's not what I wanted to do. But I realized also that the program I was in didn't teach anything about animals and public health. And I was like, this is a huge problem, right? Like there's no such thing as public health without animals. And
Right.
so I pitched this thing to my department chair, and I was like, you guys are missing out. Like, and I can give this, you know, I can fill this hole. And he was like, okay, well, you need to come in and do like I guess a demonstration session and come teach this section, and then we'll see if we want to bring you on. And so I did that. And I think honestly, what propelled me through that was fear, because I didn't like, I think part of the reason when I reflected on things was I've spent my entire life feeling like the dumbest person in the room for a number of reasons. And I had this fear that I was going to get up there and tell the students something that wasn't correct. And like, it's like the stupidest thing, right? I'm like, oh my gosh, what if I say something and then 10 years down the road, they come back to me and they're like, well, Dr. Fogelberg, you said such and such on this day in this class. And I went to this other class and they
You
told me
are
that was
way
wrong.
overestimating what they're going to remember.
Way ridiculous. So ridiculous, right? But this was what sort of drove me. And so I got up and I taught, and then I was like, oh, well, that wasn't so bad. And I think that as I was driven by that fear, what I ultimately figured out was that I loved teaching because I did love those aha moments and I loved those opportunities. But really what I loved about it was kind of the same thing that you guys are talking about, was like, it drove me to go learn something. So the class that I hated teaching the most was the class that I was most afraid to teach because I didn't know as much about it. And that was the class that I was the most successful in. So it was the Introduction to Environmental Occupational Health Sciences. It was one of the foundational courses that public health students had to take. Nobody likes environmental and occupational health sciences.
Yeah, that doesn't sound very fun.
But I made it fun. And I actually had students coming up to me and they're like, I didn't take this class when they told me I was supposed to, because they told me I had to take it from you because you were the best instructor, and you like things like that. But no, I don't know if there's a specific tipping point other than I do remember like not necessarily thinking, oh, I'm going to be a great teacher, but oh crap, I have to teach something and I have to make sure I know enough about it to teach
Good motivator.
without them calling me on my bullshit, you know?
That's funny.
And I feel like that way on clinics too, because it's just much more unpredictable what I'm going to end up teaching that way. And so it really, forces you to stay on top of, the literature in your medicine all the time, because you're like, oh my, I can't.
Yeah, these
what
residents
my
are going
case
to
is
ask
gonna
me.
be. I can't. Yeah.
Well, and
And
I think, yeah, especially with vet students, and not that my MPH students were phenomenal, but vet students, I mean, are so smart, right? And so, like for me, I already have this sort of imposter syndrome, and I'm like, oh God, these students are smarter than I am, and what am I supposed to teach them? Like, all I can be is like, well, when I was your age, I learned the hard way. So yeah, having to be on your feet, and I mean, you never know the kinds of questions those students are going to come up with. That's the scary part, but it's also the fun part.
It's the fun part. Yeah. Cause you're like, wow, I've never thought of that. Let's figure it out,
Yeah.
I had students asking me like, what do you consider like a like what's bradycardia for you in an anesthetized patient? And I was like, I've been doing this 25 years. Nobody's asked me to write that down. Like, good job,
Like,
student.
what a good question. You're like,
It's a great question.
because you're in your mind, you're probably like, you kind of know it when you see it, right?
Yeah.
Right.
Yeah.
Good answer for the student.
Well, that's what they said. They
Yeah.
like they definitely kind of gave some pushback. They're like, well, Dr. Hoffmeister, like, because you have all the experience, we don't know, so it would be helpful to have a number.
Yeah.
And I'm like, but there's not a number,
Let's just go with 40.
Then
That sounds
and then you start
good.
going all the times when like you're actually not that worried about 40 and blah blah, and
Right,
it
yeah,
does stimulate a good conversation. But Jake, so I'm really just that like gives us all these fun ideas and memories and things. But I'm curious, because you went into really internship and residency with you were thinking already, I want an academic career. I'm curious how I mean, obviously that's the only path you took, right? But I'm wondering if you noticed, like, were you pretty vocal about that? Like, this is what I want to do, and like told mentors, like, hey, I want opportunities to develop this, and if you did, how was that received?
Yeah, I think I did pretty early on, and my first rotation was as an intern was in a month of internal medicine. And I expressed that interest and that joy for teaching pretty early on. And so I was on with Beth Callan, who I had became close to over the course of that, the internist there. And so she let me lead one of the like rounds for the students because of that interest, and that's not typical for the interns to do. And so I think that got to like I did rounds on hypercalcemia for them, I believe. And I think that partially was also stimulated by for a period of time, it started my year and then I continued, but I think it might have died during COVID. Cornell had these like advanced clinical experiences. So you're on clinics there from like March of your third year to March of your fourth year. And then the last couple of months, you can either take repeat rotations, you can take classes, or you can do these ACE rotations where you do 1 week in a service that you already did. And so I did that for medicine and ECC. And for medicines, one of the expectations for that week is that you would lead rounds for the other students who you were on with that week. And so I really enjoyed doing that. And I think outside of that, rounds were modeled very well by the different services there. And so I expressed it, got to do that pretty early on at Penn. And then I think they were pretty, as a resident, pretty flexible about giving us lectures for various courses. And then they would run kind of like a 1 day, a little bit PBL style course. And they would expect the residents to be like tutors in those courses. And so doing that all 3 years and getting to be immersed in that, I think helped continue that. So I think even outside the normal expectations of teaching on the clinic floor, and or, you know, seminars and stuff for residency. I think we had a lot of opportunity, and labs. I think we had a lot of opportunities for that. I can't say that that interest was always, you know, I think I was going to say, I think it's pretty natural to sometimes feel burnout or exhausted from teaching. And so I think I did go through a period towards the end of my residency where I was like, oh, maybe I do just want to take a break from this for a bit and go into private practice. And UF was actually the only academic institution I applied to, because I was in that kind of that towards the end. And then I don't know, coming down and interviewing here, it reminded me what that passion again. And so went that route.
So I have a follow-up question to that. Because it sounds like they gave you lots of opportunities to teach, which is awesome. But I'm wondering how much education about education they gave to you in that process, and whether you feel like that was valuable, because it sounds like you met Bobby at an education conference. So eventually you came to this realization that maybe you needed more, but.
Yeah, I think almost my training up to that point and through residency, and for most of the people I know who went through residency, was entirely based on modeling. So, you know, we saw what worked for us and what we liked during the learning process, and then attempted to recreate that as best as we could.
So what encouraged you to maybe pursue more? I mean, obviously you went to a veterinary education conference. So what encouraged you to pursue more sort of understanding of education itself?
I think I think I started reading some of the education journals, like Academic Medicine and JVME, and just Academic Teacher, maybe, is that one of the other ones. And so I started following those, got really interested in it, and different kind of like looking at different teaching tools and ways of teaching. And then I have been friends with Kathy Edmondson, the assistant dean at Cornell, for a long time. And so she reached out because she knew I was in Florida and was like, you know, Cornell Veterinary Educators Academy is 2 hours from you in Sarasota. You should consider coming. And I think that email went out to UF because it was so close to us. And so I went, and really, really enjoyed it, and went the next year as well, and then CVEC this year. So
yeah. So kind of, again, to kind of piggyback on Catherine's question, I know when I was at Florida and we would be like interviewing candidates, you know, not even just for ECC, but like any interview I was involved in, I was always like, and then just so you know, here are the programs we have for like education and things like that. Did you, and because one of the things I'm curious about is, you know, how things have changed in veterinary academia as far as encouraging, embracing, rewarding, recognizing, you know, efforts specifically in education. And so I'm wondering if, you know, any of that, you know, what's been your experience at Florida, you know, from when you interviewed until now?
yeah, I think it's been pretty positive. So they have the first year faculty teaching academy, I think it's called, that is run by the Center for Teaching Excellence down campus at UF. And so they, I think, strongly encourage their new faculty to join that. And so I did that my first year. And I think it's a 6 or 8 week program with people from all different disciplines. And there's lecture and workshop components and things like that. And I found it really, really valuable. Some sessions more than others. But I think it's sometimes hard for like the health sciences crossover, because so much of our teaching is on the clinic floor, and so it's pretty distinct. And then often the lectures that we give are not in our own courses necessarily, but are part
a
of
one-off lecture. Yeah.
and so it can be harder to, you know, revamp a syllabus or something like that when you're in that role. But yeah, I found that really, really rewarding. And I think they were pleased that we did that. And then I I think that they've been very open to kind of the redesign of courses or new rotations that we've started since I started, or some of those initiatives.
That's
In
great.
terms of them being pleased, I'm curious, like when you had your yearly eval with your department chair, did they make a note of that and they were like, yeah, we're really glad that you did this, you know, like did that factor into your evaluation?
They did, and they said that that would look good for promotion for our P&T packet moving forward.
That's great.
Yeah.
Yeah,
So,
it's so good.
yeah, because I have a bone to pick with a lot of people who use this term frequently but incorrectly. Do you know what the definition of didactic actually is?
I guess I don't know.
Yeah. So people
Oh, dear.
use this as like they split out didactic from clinical teaching,
Right.
but didactic actually means intended to teach.
Mm.
So just your little takeaway from tonight, if people say didactic, you need to tell them that that does not mean lecture-based. That means intended to teach, and that covers all teaching within the curriculum. I don't know why that just popped into my head, but
Probably
as a new
because I just used
educator,
it
I wanted you to know.
Yeah. So Catherine like taught me that too. I didn't realize that a few years ago. And so, yeah, I just changed now. I either say classroom based or lecture based teaching, if that's what I mean, rather than didactic. And I'll be honest, I'm not as good about like saying, hey, that's not what you mean. But I will say when I'm reviewing articles for JVME, I will address it for so I'm like, at least if in print, like for all, for posterity, we try to get it right. But
I'll take what I can get. Small
yeah.
That kind of makes me think about what you were talking about with model teaching, Jake, and how, you know, that it is like the apprenticeship of observation is how the vast majority of us taught. And I think that we understand that there are limitations to that, but I think that there's not very much of a conversation about what exactly those limitations are and the deficits with that model. Because yeah, just like Catherine pointed out, like they're like theoretical things about teaching people that if you don't ever learn, your own teaching is going to be held back or stymied, I think, you know, because what if you have a person that, you know, just never models a way that would work really well for you?
Yeah.
Or what if they are modeling things that are maybe not so good, which, you know, in my experience was very true of me for a long time.
Yeah, I think
Or they're
that's
modeling things that are only good for you, you know?
yeah, exactly.
It doesn't apply
Right.
to
So
any of the other learners.
yeah, that's my other like big pet peeve is when people are like, oh, teaching best practices. I'm like, there's no such thing as a teaching best practice. There are good practices and there are practices that work in different situations, right? So best practice indicates to me that no matter what you do, it's going to work all the time. And maybe that's an incorrect interpretation on my part. But good practice means, you know, when you're teaching on the clinic floor that maybe you don't use the same types of, you know, pedagogical techniques that you use in a lecture versus using in a lab versus using online versus in a classroom. So yeah, I think that's exactly right. And I talk a lot about that too, this idea of this cognitive dissonance. If you understand the theoretical underpinnings or the approaches to education, and sometimes you realize, oh gosh, no wonder I couldn't get through to this group of students because I'm teaching the way I like to be taught, but none of them really want to be taught that way, you know?
I think that was a
you're
really
teaching
good.
and yeah, you're being forced to teach in a way. Like I talk to administrators sometimes about this too. It's like, well, what is your overall educational approach? Like, do you really believe in active learning or are you really much more of like a sit and get? And it's not that one is better than the other, but if you're bringing on instructors who are really active teachers and active learners, but you're wanting them to kind of sit in this, only give them lectures, then you're not going to be very excited or do very well. And I think that burnout happens a lot sooner.
Yeah. But I think your point, Jacob, is you're like, yeah, the modeling is great. And you're going to emulate the things that you liked that worked for you.
Yeah.
And again, that's probably going to work for a lot of other people as well, but you're digging deeper. And I think that what makes us all really excited. You're like recognizing that just because I like this doesn't mean everybody likes this or that it's going to work in all situations. Like this might be great for learning this particular topic, but this other topic doesn't lend itself to that particular style. And so when you start to learn about, like you said, the theory behind it and, you know, how learning works and why these things might be more effective in these situations than others, you can become that much better. Because there's a lot of like what are really good teachers out there that don't really have training. And some of that has been trial and error. And, you know, maybe they had good modeling, but I would argue even those really good teachers could probably get better if they had some additional training. So I think it's really great, one, that you've sought that out, and two, that you're getting supported in doing that. And that your department head is like recognizing this and encouraging you, yes, do more of these types of things. And that's what I was hoping to hear today.
Yeah.
I was really hoping to hear that things are improving. And again, when I left Florida, I felt like that's how things were changing. So it's good to hear that we're still heading in that direction. And is that a conversation that is had not just like maybe between you and your department head, but like at a department level or even a college level about, okay, what are the things that are going to get you promoted? And is there a lot of energy and effort spent on like education stuff is one of those things?
Yeah, I do think that is these conversations are happening to some degree. I don't know that we have a lot of conversations about promotion and the path to promotion as a college or a department, other than like your one-on-one discussions with your mentor or with the department chair. I do think that as far as like we are redoing our curriculum right now. So the preclinical curriculum, we just voted to switch it to systems based, but there were kind of 3 pillars of it, and they elected the curriculum committee elected not to separate any of the pillars, and so it was a vote on all 3 at once. And so it was systems based, switching to satisfactory, unsatisfactory grades, and a requirement for active learning within each block. And so it passed with like overwhelming margins. And so now over the next 2 years, I think those courses
Gotta get
are
done.
have to be completely redone.
Yeah. The vote, the easiest part.
Yeah, exactly. But I think it's exciting that, one, there was a lot of buy-in from the faculty that 80% or more voted for this, and the biggest controversy was the graded portion.
Sure.
And two, that we're going to have kind of these systems based, but then also have components, and ECC falls into this, where it's threaded through that curriculum and gets to work with each of those systems based experts. So I think we're having those conversations, and we'll have them even more so as we have to write the syllabi for these courses and then bring it to the professional curriculum committee.
So are you heavily involved or planning to be involved in that process?
I think that I will probably be either I don't know yet. I think I'm newly on the curriculum committee, so I started this month. So I'll probably have a component in there, and then I would not be surprised if I become one of the whether it's the course leader for the ECC portion or the threaded component. We'll have 2 different people for those. So we'll see. But the department chairs have not decided those roles yet.
I'm curious. I'm going to take us back to the promotion and tenure conversation. I'm curious because I am not board certified, and I wonder if those conversations are more open with, or what your perception is about whether those conversations about promotion and tenure being focused more on education are easier to have when you're already board certified in a clinical specialty versus somebody like me who comes in without. I mean, I'm a GP. I've been your GP for 13 years and never killed anything I wasn't supposed to. But I just wonder if in academia that's viewed a little bit differently, because I have my own opinions about that. So I didn't know if any of the 3 of you had any insights or observations about that.
I think it depends on your institutional culture and perspective. Like at Midwestern, we had a very strong GP department, and so they were not boarded for the most part. But it was expected that they would be, effective teachers. On reflection, we didn't do very much to facilitate that and or reward it. But I think that it was more understood that they were, on par with the specialist faculty. It would be really interesting, Jake. You say that you are not aware of the conversations. It would be interesting to see like what the conversations are like in P&T committee meetings, because I'm in all of those at all the institutions I've been in for the past 10 years. And I recently here, we had a faculty member who was going up who had mostly educational research publications, and it was an argument. You know, it was not like a slam dunk. Like, it was a bit of a fight, which was disappointing to me.
Yeah.
Because that type of research wasn't valued by some.
It's a little bit unclear to me what their feelings were, to be honest. I think they didn't articulate them very well. So I think it was like, we do biomedical research, you get biomedical publications, it's very obvious when you meet your requirements for P&T, and then just like, it's a rubber stamp. But this CV was not looking like that. And so I think that, frankly, my interpretation is it was feelings made out of ignorance rather than maliciousness. Like, they just don't know the work that goes into educational research and publications and why it matters and all that sort of thing. So I would like, this is probably over glorifying my role in this conversation, but I would like to think that I, like, having explained that to them and pushed back, like, I feel like they were like, okay, like, that is work.
Yeah.
Was that person already board certified in something else, or were they
Yeah.
Okay. See, and that's where I'm curious, is because we are going to have to see more and more non-specialty board certified. I mean, even the folks at Virginia, Maryland in the community practice, most of them are board certified as ABVP, and which is great. I mean, I think that's fantastic. But at the same time, you don't have to be board certified to be good, at whatever it is you do. And in my perception, and I'm interested to know what Bobby and Jake's perceptions are, but in my perception, it's always been a handicap for me.
Yeah.
It's always, oh, you're just a GP.
Yeah, I think my perception is you're starting to see that change. I do think we're starting to see, but just like anytime the change is starting, it's rocky, and it's like up and down, and it depends, like Eric said, what your institution, where they are. I think that a lot of the new vet schools coming online is out of necessity going to be changing that to a large degree. Part of it is, I think the surgence of distributed model schools is recognizing that, hey, actually, a lot of these general practitioners and non, board certified, like, people don't have to be board certified in a specialty to teach veterinarians to be veterinarians. Like, right? We're not asking, general practitioners to train residents in a specialty. That doesn't make sense. Nobody's asking for that. But we're asking, experts, veterinarians who are experts in their content, to train the next generation of experts in that content. And so I do think a combination of people, like, expanding their understanding of what it means to be an educator and to be an expert, as well as, in some ways, necessity, right? Like, there just aren't enough veterinarians, period, to go around. And I think you'll start to see people go, oh, it turns out actually having a general practitioner who maybe has extra training in education might even be more valuable than having a specialist, because we're not training specialists, at that level, right? If we're talking about teaching students, I don't need, and I would argue in some cases, in many cases, those specialists without additional training are sometimes not the best people to be teaching first and second year veterinarians. So I think things are changing. We're not there. I think we're further along in our appreciation for education itself, like as a track, and as, adding value to the college, wherever you happen to be. I think we're not as far along in recognizing and appreciating the contribution of general practitioners. But I think it's starting to change. I'm seeing glimpses of it.
Yeah, I agree. I'm curious. I don't know if you have anything to add to that, Jake, but I'm curious about your perspectives.
I don't know that, I mean, we have our setup. I think we have like 1, 2, 3, 4, 5 faculty in our primary care service who are either as clinical assistant or associate professors, and then one who's a clinical instructor. And so if they're the instructor professors who are that one individual, and then all of our ER doctors, their promotion is based mostly on their clinical time and their student reviews. But the ones who are clinical assistant professors have usually less time on clinics, and then do have some research requirements, and usually more of a teaching role. And so I think based on that they do like have that within UF. But the only two who are associate professors are both board certified.
Okay.
So I'm not sure how much that affects promotion. I will say that they do it kind of, I think it changed recently, but most of our effort reporting, because it looks better to down campus, I believe most of our clinic time is actually marked as teaching rather than clinical. Uh,
Clinical service, yeah.
rather than clinical service. Since
I mean, which is fine because the vast majority of time you do have students.
absolutely, yeah,
It's teaching, right? So
and then for the research component, I don't know, when I had talked to them about different research projects, they were enthusiastic about education being a component of that, but I don't know how that's the department chair. I don't know how of course, the P&T or our down campus P&T looks at those.
Well, they let me through when I was there, so.
no, I mean, I think that's encouraging, and I think it's interesting to hear Eric's perspective because you've had so much experience on those P&T committees, and it is somewhat disappointing. But I agree with you, Bobby. I do think it's changing. I definitely see the tides changing. I was actually talking to Peter the other day because he and Megan and I were chatting about a presentation he's getting ready to give, and we were talking about the fact that, when I graduated in 2014 with my PhD in education, I was literally one of 6 people in the United States that had a DVM and a PhD in education. Wow. And now it's 2024, 10 years later, and there's probably 20 of us, which I mean is exponentially more. It's not enough, right? And there are significantly more and more folks now, obviously, who have, master's degrees in education and DVM. So I definitely see the tides changing. But I agree with you, Bobby. I think it's slower on the uptake to accept GPs and the expertise that they bring than it is to accept the educational expertise that's coming on board.
Because they're getting hired at the colleges, but usually in different roles. Like you said, either they're in an instructor role or they're in, every university has a different, set of, their lingo is different, but it is usually different. In a lot of those cases, might be in the professor of practice line. That's one of the things we have at Virginia Tech. And so, there is still an othering, to that. But again, change does not happen overnight. It's always incremental, and there's always setbacks and things like that. So I think it's heading in the right direction. And I do think the general appreciation, the improvement in appreciation for education and pedagogy, those are going in parallel. And I think that helps. But there's still holdouts, right? Like kind of I was saying, like there's some people who just don't get it. And they're not, like you said, trying to be malicious about it. This is so different and they've never considered this. And so they don't understand it. But I think we're seeing progress.
Yeah, well, I mean, the numbers tell us that can't keep going the way it's going, right? I was just doing some quick calculations. There's about 115,000 veterinarians in the United States, and about 15% of veterinarians are board certified. So that means there's about 17,250 board certified veterinarians, which means when you have 34 accredited vet schools online and another 15 coming online, so you got 49 vet schools that you got to fully staff. And oh, by the way, we still need specialists in clinical practice. So one of two things has to happen. Either another pool of educators has to be found, or we need to make more specialists. And I would argue that we need to do both.
We need both, yeah.
We definitely need to increase the number of specialists, make that a little bit more, not easier, but more accessible. Pay them better, give them opportunities to, to do that.
And I think we probably also need to look at the clinical curriculum and make it less of a specialist focused clinical curriculum.
They're here.
And they're doing that in England. Actually, the Royal Veterinary College just revamped their requirements for their clinical year students a couple of years ago, and 70% of their requirement is now general practice, which is aligned with the number of students who go into general practice. And oh my gosh, makes so much sense. I
want it to be general and emergency or urgent practice, because
I
do think emergency practice is part of general practice.
Very,
which I think a lot of the places are doing that.
Our graduating class last year, 30% said they were going into emergency.
Yeah.
It's a lot.
But again, even the ones that said they're going into general practice, like, guess what?
They're going to see emergency.
I mean, I went into general practice and I did a lot of emergency because a lot of times they come hand in hand, right? Like you can't really do one without the other.
Well, and so much of emergency practice is not real like emergency practice. It's first
Urgent.
opinion,
Yeah.
wellness care, not wellness, but like unwellness care, I guess. Right.
Yeah.
And so I think from our student training perspective, I think the general practice setup and the urgent care emergency practice is just the greatest opportunity for them to see the things that they're going to see in practice versus,
Hey, can
versus
we
training them with the things they're not going to see.
Yeah.
can we talk about research? Just I think we have enough time
Oh,
for like one more
yeah.
topic. So Jake,
Yeah.
you alluded to like publications, sorts of things. Are you doing any educational research? Do you have ambitions to do so? What are things that more experienced faculty can do to facilitate newer faculty doing more of this? I would love to know the answer to that.
Yes, Jake, tell us.
Yes.
Yeah, I am doing some. So Bobby and I are actually working on one that's kind of education adjacent about trying to understand ECC resident decision making when talking about critically ill patients with clients, and kind of doing like an interview-based study.
Share how that came about.
What?
This part, I think you need to share how this idea came about and how it happened, because I think this is just a really great approach.
So I had read a kind of a similar study in human medicine for ER residents in Canada, and I found it really interesting because it always is curious to me, like how they phrase these conversations, how comfortable they are making recommendations, where they learned to make recommendations. And when Bobby and I discussed it, we realized that we offer structure things to clients in similar ways, maybe, but from our kind of preliminary interviews, it's clear that not all others do. And so we just trying to figure that out seemed fascinating. How are we teaching them to do this, and could we do it differently, and are they coming to conclusion or coming to structures that we like? And so I read that, and then I was like, well, it reminded me of Bobby and her research, and so I just cold emailed her and said, Bobby, I read this, would you like to do a project similar to this? And
I'm sure you had to twist her arm real hard.
But I think so I love the fact that when you're consuming research, right, and you're looking at different things, and you go, man, that's a really great idea. But this is in human medicine, and there's probably some differences. But we could model a study after this. Like, so I can stand on the shoulders of other really smart people, and we can do some of these things. So that was number one, I think, is a great way to come up with ideas for research. Because again, not only because one study doesn't answer all the questions, but yeah, it's a really good way of doing it. And then two, just being like, hey, I wonder if somebody else who maybe, knows a little bit more about this, or if nothing else, could put me in contact with other people. But yeah, just like reaching out to people, because oftentimes, I mean, this is kind of where like Eric did the same thing. He was like, yeah. hey, y'all, I have an idea for a study. Would you all like to work on it? And I say yes to these kinds of things because they lead to really cool things down the road. And so those are the two things I would love for listeners to take away from this. Is one, like, it's okay to like steal ideas from other people's research. I think it's a great way to do things. And I'm confident we'll end up citing that study in the final publication.
Definitely will.
And two, just reach out to people to collaborate, because you'd be surprised probably how often that's successful.
Yeah. And I think my other research project is kind of born from that, and I haven't written it, but the data is all collected and analyzed. And so the other one was an antibiotic card game that I created to teach veterinary students. And again, I saw in one of the human education journals, in like a letter to the editor or something, the pediatrician in California mentioned the empiric card game that he had created, and I looked it up and looked up his rules, and I was like, oh my gosh, that's really amazing, like really well done, beautiful images, seemed really informative, but I couldn't find his email anywhere.
No.
So I tweeted at him and was like, this is amazing, would love to do a veterinary version. And he tweeted back and he was like, me too, let's
awesome.
See, I love it.
And so we set up a meeting, and then we created like a small animal version, and eventually we made an exotics version as well. But we created like a so I use it during rounds when students are on their ER and ICU rotations. One of the topics is usually antibiotics. And so I incorporate it by kind of giving them a pre-survey, asking them different questions about diseases and how they treat them and stuff like that. And then I give we kind of do a round session for 30, 45 minutes on different types of antibiotics, how they work, stuff like that. And then they get a mid survey, and then we play the game, and then they get a post survey.
Very cool. I love how modern you are. You're like
Yeah.
tweeted at this guy, and now we're like research buddies, and I love it.
You know, the other thing I love about that is that you didn't let the fact that he was a physician sway you. Because I think when I think back to my days as a veterinary student, there was this like constant divide between the veterinary students and the medical students. You know, it was like this competition. And I think I came out of vet school thinking, that, you know, medical people don't respect us. They don't, you know, and I've actually found that to be quite the opposite. I mean, whenever I've had individual conversations with physicians, they 100% respect what we do. And I totally respect what they do, and we can have great conversations. And I think it's important to continue to build those relationships across, you know, across that border, because there's so much we can help each other with. If we would, we would be so much better if we just all worked together. So I love that you were willing to do that, because I think sometimes people get jaded and they're like, they're never gonna, you know, want to do.
I think they're so excited. It's not even like one of the cards was a prostatitis, and on the back, you know, we create there's the right answers, but then there's kind of like a discussion about the disease process. And you know, he after creating it, he tweeted out the card, and he was like, "This is definitely the first time I've ever recommended castration for a patient." And
getting a kick out of it. I love it.
Nice.
And so yeah, I think it's fun for them, and it is when, you know, we have a really complicated case and they have to be involved, or at these different conferences where we get to meet them. I think it's exciting on our end and theirs, and we have so much to learn from each other. So
yeah, definitely, for sure. That's awesome. I'm excited to see what comes out of both of those studies. That'll be really fun.
Yeah, pretty exciting. So yeah, I guess maybe if we have room for one last question. What are, you know, early in your faculty career, what would you say have been the challenges for you when it comes to the education side of things? So, you know, what are the things that you've struggled a little bit with?
I think one of them is the administrative burden, I guess I would say. I think in trying to do some of the different things, whether it's creating a new course or switching a course to pass fail, or creating a new rotation, or you know, checking off all the boxes for educational research for like an IRB. Like there's no guidance or organization. There's no protocols. These pieces of knowledge are just like hidden in different people around the college, and it's like a scavenger hunt, and you get to try to find each nugget. I think that having like something centralized where like everyone knows this is who you go to for this, and then they can say like, oh, you're trying to do this, here's the steps that you need, here's the check boxes that will need to be done to do that. I think that is it has been one of the hardest parts for me as a new educator. I think some of the others are logistical things, like we're starting a course that Bobby got approved years and years ago, an advanced critical care medicine course. We're finally starting it this fall, and we switched it to a like small group problem-based learning course. And so we have, I think now 6 different groups of 8 plus a tutor in each group. but we don't have a single small room that you're allowed to use for teaching in the in the college. We have ones in the hospital, but those are off limits for classes. And so we, get to divide in a tiered lecture hall, which is doable, but doesn't really foster that kind of collaboration that you're hoping for. And so I think that's been kind of a little bit disappointing, especially when I said, like, oh, there's these rounds rooms that are empty for 3/4 of the day, or these conference rooms in these areas, we only meet 7 times or something like that, and it was just a no, and there's no discussion or place to go from there. I think that was a little bit disappointing.
So my advice on that, Jake, is ask every single year, maybe twice a year. Just keep asking. That's worked for me for a lot of things.
Or just do it and then ask for, just go.
100%. Just squat. Like, if no one's using them, like,
that's what I would
guys.
do.
Yeah, that's true. Somebody has to be walking around working to find you. So
exactly. So I think I'm a total word nerd. Everybody knows this who knows me. And I want to just point out something that I think is really awesome about the way you just described your challenges, Jake, which are, I get to find these little nuggets. I get to do these things, not I have to do this or I have to do that. And I think it's one of those things that as instructors, as teachers, it's something that's really important for us to model, right? So when I was doing examinations day, for example, I'd be like, oh, is everybody ready with our celebration of knowledge today? Right? It wasn't like this horrible thing. But it's also important to talk about students earning the grades that they earn, not me as an instructor giving you a grade. It's like, you've earned this grade and you can either be proud of what you earned or you can be upset about what you've earned. But I didn't give you anything, right? And so I just wanted to point that out because I love the way that you phrase that. It was just so positive, and I think we need to be really careful about the language that we use on a regular basis. So thanks for that.
Good call out.
I wish I could say it was intentional.
Honestly, even better, like that it was just like, this is how I talk. Like,
yeah, exactly. That's even better.
Yeah. It's somehow or another just become ingrained, and it's great.
It's awesome.
So excited about all the things you're doing, and that you're having, like, you're getting good feedback and feeling generally, it sounds like maybe struggling to figure out the nuts and bolts, but at least generally getting support for the things you're doing and the things you are, dedicating time and resources to, which is just really, really great to hear. Really, really proud of all the things that you're doing. And it's great to see you at these education conference. It was wonderful to see you at the CVEC boot camp a few weeks ago. And so glad you joined us on the podcast. It was really fun to hear about. We're going to have to chat more about your background in religion. I'm in philosophy in undergrad. And so I'm like, oh, we can have some conversations.
I am irritated that you didn't introduce us in Athens, Bobby. I was right there. You could have been like, hey, Jake.
I am irritated that I wasn't there because
I was also irritated about
probably don't know this, Jake, but Eric and I have been working together and have known each other for 5 years now, maybe. And we've literally never met in person.
Wow.
Never met in person. Wow. And he never went to boot camp. And then the one boot camp he actually went to, I didn't go.
So. He was at the last 2 boot camps and you were not. So shout.
Okay. It's my fault. Someday, Eric, we will meet in person.
In Gainesville next year for
That's right. That's right. It is going to be in Gainesville. Yeah, Jake's going to be hosting. Yeah. So
I'm not an academic anymore, so I don't, I don't.
You're still invited. You're still invited.
I know, but I got to get the time off.
That was my bad, Eric. I'm actually like the worst networker there is. I genuinely am. I'm terrible at it for myself.
Because everybody knows her and she doesn't have to introduce herself to anyone.
That's the introvert in me, right? Like, I know you all think I'm an extrovert, but like, I'm like very 50-50. I'm like, okay, I've done enough talking today. When do I get to go back to the hotel? That's those things there. But anyway, it was just wonderful to have you on the show, Jake. Good to
nice
catch up and
see you, Bobby.
I'm sure that there will be more interactions down the road. So thanks again for joining us, and thanks everyone for listening. We'll catch you next time.
Bye-bye.
Bye.